Joining us today is Dr. Todd Elmore and Julie Edwards from St. John's, here to talk about a unique program to help treat patients in rural areas. Thank you all so much for joining us today.
Thanks for having us.
So today we want to talk about this alternative health care to provide for patients called telemedicine. Explain to us what this is.
Sure. Telemedicine is the use of telecommunication technology to be able to provide healthcare services through usually two-way video, but there are other ways of doing that as well.
And then explain to us the difference between telemedicine and telehealth.
Telemedicine is the actual provision of care of services. It is the doctor-patient interaction. Telehealth is a more general term that people use to describe just general health care that encompasses education, wellness, and other healthcare information.
Now, how do community members determine if telemedicine is available to them?
If they haven't already used it, they can check with their local hospital or with their local EMS provider. Also, their insurance companies may be able to tell them if they have insurance coverage for telemedicine services.
Excellent. Now, Dr. Elmore, is there a difference between telemedicine and in-person care?
There's not a big difference. You can pretty much provide the same services through telemedicine that you can provide in person, other than procedures or things like that. But mainly for particularly consulting services and things like that, there's very little difference between telemedicine and in-person care.
And let's also talk about the benefits of using something like telemedicine.
Well, one of the advantages of telemedicine is it allows you to offer care in areas that there aren't a lot of physicians. It saves the patients the need to drive long distances for something they could really very well do over, even the telephone or through any sort of audiovisual setup. It really helps patients who, particularly who can't travel. And that's a big deal in neurology, particularly. We have a lot of patients who don't have driver's license, very difficult to transport, and so it's very helpful.
Absolutely, especially in those rural areas. Well, thank you so much, both of you, for joining us today. We really appreciate it.
Thank you.
All right, thank you.